I'm Mary Lloyd, Ireland, and I was honored to be asked to speak at the Houston Society meeting. My talk was on ACL reconstruction and return to play. This is my website, marylloydireland.com. I have nothing to disclose. How do we get the quadriceps back? It seems like the quadriceps moves out of the bodybuilding variably for different patients. It's different for some. It comes back quickly. For some, it comes back in a year or maybe even 2 years. Open chain extension machines, are we safe or sorry with these? Certainly from 30 to 0 degrees, there is force that we don't like on our ACL grafts. However, open chain extension machines do isolate the quadriceps in a way that no other activity does. Dr.Gideon Ariel developed this dynamic variable resistance in 1976, so it's been around quite a while. And that was the Universal Centurion DVR leg extension machine. In my patients who are not ACL patients but anterior knee pain patients, this does create more anterior knee pain, so we know in certain individuals we have to start up above and not isolate this. But in our ACL reconstruction at an appropriate time, 6 months, 8 months, 12 months, adding back the extension machine is very important. Some patients never do extension machines, and that may make it difficult to get full quad function back. The individual on the left is a diver. You can see she doesn't have much quad development, so she is more of a ligament dominant individual, and this football athlete is more of a muscle dominant or a very well developed quadriceps. So we have to individualize it to some degree, but opposite side as far as the quad is important to test the quad. We must test it eccentrically, relatively fast, probably greater than 180 degrees, open chain. There are safe variations of eccentric quadriceps. Total gym with bands early, do later higher amount of weights, but start off with smaller amount of weights, less weight. Eccentric quads, I think we can do these things pretty early. Step up with a dumbbell. Don't do the lunges or step down too early, but step up. How about doing squats as in the middle with a wedge? That puts a little bit of maybe eccentric load on the quadriceps, elongates the quadriceps, or use these foam half rollers. So I think we can start doing that relatively early. Eccentric quad with band, as in the upper left, doing some of these TRX or these other activities with bands, I think is safe and can be instituted early. And then certainly later on, higher amounts of weights, doing step-ups with weights and advancing the weight. There is some research ongoing in our lab of KAATSU training for rehabilitation after ACL reconstruction. So this is ischemic training, and in early results, the quad seems to be coming back when patients are training in this way. So this is an interesting approach and one that you'll see more of in the future. A lot of elite athletic training rooms have these devices and they're using it for their injured athletes. This is my website, marylloydireland.com. Please visit it. There are presentations such as this one narrated on the website. Also publications, travel, other links. Thank you very much from Lexington, Kentucky, the University of Kentucky Medical Center. These are our references.